Good morning, and I will now call to order the September 23, 2021 Clackamas County Board of Commissioners Business Meeting. Gary, please call the roll.
Thank you, Chair Smith. Our staff support today: Shannon Bays, Clerk to the Board; Stephen Madcore, County Counsel. Roll call: Commissioner Savas?
Here.
Commissioner Schrader?
Here.
Commissioner Fisher?
Here.
Commissioner Shull?
Here.
Chair Smith?
Here. All rise. I will lead us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Good morning. We are holding this meeting in person and virtually. If you've joined us via Zoom for this meeting and are interested in providing public comment, we will prompt you regarding how to do that when the time is right. As always, the public is welcome to sign up to testify. Registration for public comment will close at 5 minutes past 10. I would like to remind all participants, including staff, all elected officials, and members of the public, that Robert's Rules of Order will be enforced during this business meeting. A quick note about the changes in the procedures. We have brought in security to help us keep everyone safe during this building. You will continue to see them in our lobby outside our hearing room every week. Gary, please call the first item.
Thank you, Chair Smith. First, we have a wildfire update. Daniel Neibauer, Interim Director of Disaster Management, will present. He is on Zoom. There you are. Go ahead, Daniel.
Hi, good morning, Commissioners. Acreage for the Bull Complex fire is currently at 24,837. That's up 3,646 acres since last week. Containment is at 20%. It's up 5% since last Thursday. And personnel is at 478 that are working on the fire. That's up 21 since last Thursday. The fire has pretty much just been smoldering and slowly creeping along. There was only 60 acres of growth yesterday, and fire activity is anticipated to be low today as well. Personnel continue to monitor, patrol, and reinforce control lines. They've begun removing hazardous trees that are fire damaged in some of the affected campgrounds. And drier and warmer weather through the end of this week may dry out some fuels from growth, but there is more precipitation anticipated coming in the beginning of next week that we're all looking forward to helping to help put out this fire. That's all I have, unless there's any questions.
Thank you for that, Daniel. Does any commissioner have questions for Daniel? See none. Gary.
All right, thank you, Daniel. Next, COVID-19 updates. Philip Mason Joyner, Public Health Director, will present. He is also on Zoom. There he is. Go ahead, Philip.
Good morning, Chair Smith and Commissioners. And like always, Shannon, if you can please put up the slideshow for the weekly COVID update. Thank you so much. The first slide we'll show, like usual, is our weekly case counts for Clackamas County and also our neighboring county. Here in Clackamas County over the past week, we've had a little less cases, which is very good, 841 cases, and sadly 5 individuals have died. Comparing to Multnomah County, they've had a little over 1,100 cases and 5 deaths, and Washington County a little over 1,000 and 5 deaths. Next slide, please. This is our weekly case graph, so it is a positive outlook. Our trend the last 2 weeks, cases continue to move downwards. So that is certainly wonderful news. We hope that this trend can continue in terms of slowing the spread of COVID-19 in our community here in Clackamas County. Next slide. In terms of hospitalization trends, this is also perhaps not yet at a point where the hospitals are feeling good. It's still quite busy, our hospitals, but it is looking better, just like our case counts. 944 COVID-19 positive patients in our hospitals across Oregon as of yesterday. And we have 26 current ICU beds currently available in our region, which you can see those counties, the top left there in blue on the map of Oregon. So getting a little bit better. We hope that this will continue to move in the right direction as well. vaccination efforts, we continue to work hard to make the vaccine available through regular clinics that the county is providing, through our partnerships with healthcare clinics and local pharmacies, and putting on events with community-based organizations. Little over 267,000 individuals in Clackamas County have been vaccinated. We're still hovering around 73% of folks who are 18 and older who have received a COVID-19 vaccination, and the state of Oregon right now is at 74%. So we're right there in terms of the average of the state in terms of folks who have received the vaccine at this point. I think it's well known that there is a new requirement across the state, requirement for healthcare workers to be vaccinated and educators by October 18th. This is information that the Oregon Health Authority provided us. I do think it's helpful to share and to know that for Clackamas County residents who have identified themselves as healthcare providers, Clackamas County, we're at 87% of our healthcare workers currently who have been vaccinated. So that's a really high amount. We're actually the second highest performing county in Oregon on this metric. So very happy to see that, and really hopeful that this requirement will not have a huge significant impact on the workforce. Next slide, please. Last week, I shared that on last Friday that a group of experts were meeting to make a recommendation on booster shots for the Pfizer vaccine. And their recommendation now has come out. There's been a lot of interest in the public and curiosity about next steps, but they did recommend that individuals who are 65 and older should receive the booster shot if they received the Pfizer vaccine initially. And now that is moving forward. Tomorrow, the Oregon is part of what's called the Western State Scientific Safety Review, and that will be looked at. And then once OHA moves forward with that recommendations, we'll be able to provide boosters for this population locally. We're anticipating Clackamas County to begin providing boosters the first week of October. Our focus will be going back out to homebound individuals, working with all of our long-term care facilities, and there's over 70 in our county. And also for this population, we'll be making, starting with appointment only. So folks are able to call our call center and hop onto our website to make appointments. In the next couple of weeks, we'll really be promoting and providing that information to individuals 65 and older to get them access to a shot. They can also go to local pharmacies, and they can go to local clinics. There is plenty of supply of the Pfizer vaccine available across the state of Oregon and in our region. Next slide, please. I did watch the board session on Tuesday, and there was a great discussion around natural immunity. I wish I had all the answers around natural immunity and the common questions that are coming up in the community. What I can share is that natural immunity is something that's continuing to be looked at around the science. When I say natural immunity, that is exposure to the disease that occurs through infection. And it's variable in terms of the level of protection that an individual receives, dependent on how long ago did they get infected with COVID, how strong of an immune response an individual may have. Individuals really should discuss if they have been infected and are hesitant about the vaccine. We really want to encourage you to talk to your trusted healthcare provider. State guidance does state that an individual can receive the vaccine as soon as they complete their isolation period. So shortly, 10 days after you test positive for COVID and no longer have symptoms, you can receive the vaccine. We know folks have questions about this. Really encourage you to talk to your healthcare provider. Next slide, please. And in testing continues to be a challenge. A lot of demand, especially with students back in the classroom, with folks traveling more and airlines requiring negative COVID tests in order to travel. Some businesses already requiring it for employees to have regular testing. And public health we're really, our testing resources are really being put towards providing access to those individuals who have been exposed to COVID, been in close contact with someone, or they're symptomatic. Certainly with the workforce, healthcare workers treating COVID positive patients, providing vaccinations, providing testing, our public health staff, nurses also doing contact tracing. And then across the community, just regular health services. I think all systems around healthcare are strained, including testing. So just wanted to share that with the board that there's a lot of good information. There are resources and access to testing, but right now you could expect to wait a couple days before getting access to an appointment for a test. And next week, October 1st, is the deadline for our community-based nonprofit partners to apply for this funding that the work really needs to happen this fall. The dollars have to be spent by the end of the calendar year in terms of working with us directly to reach out to populations across the county and help increase access and increase education of the vaccine across the community. So for any organizations that have been watching this, is last call this week, up to $30,000 available to you. Plenty of funds still available to apply for. It's a pretty simple application. Please go to clackamas.us/grants for more information. And then finally today, just want to continue to promote our ongoing vaccine clinics. We are in Canby. We are at the Town Center Mall. We are in Molalla. We have been at the Providence Medical Clinic there in Molalla for several weeks. We are now moving to the United Methodist Church. So thank you to United Methodist Church for making this service available. We're happy to be there. We continue to be partnering with Providence at the Willamette Falls Community Center in Oregon City, and up in Sandy, up on the mountain at the health center there at the high school. Those are our standing clinics. There's also a lot more pop-up clinics and other opportunities for folks to get access to the vaccine. Encourage folks to visit our website for the most up-to-date information and their appointment options, and there are also walk-ins. That is all the information I have today for the report. Thank you so much. I'm happy to answer any questions that the board may have.
Thank you, Philip. I have a couple of questions. If somebody wants to be tested, again, where is the best place to go?
I would recommend go to our Clackamas County website, clackamas.us/coronavirus, and there is a test. There's actually some nice resources. It has a list of current places. There's pharmacies, there's clinics. You can type in your zip code and get access to appointments and schedules.
Okay. And what is the cost to be tested?
Most places it's free. At-home tests, there's a lot of interest in at-home tests. You can try to go to a local pharmacy or grocery stores. They have them on the shelves, but they are at times sold out. They're $30 for a 2-pack at most places I've seen. But most places, they will ask for your insurance card if you have it. In most places, there's not out-of-pocket expenses. I would say most places. Sometimes there are, especially if you need it quickly.
So if I pick up a test at the pharmacy and I do it at home, do I return the test to that same pharmacy?
No, you'll be able to receive the results. It's a rapid test. You'll be able to review the results at home.
Okay, good. And that tells you just like other tests I'm aware of. Thank you for that. Now, you said there were 70 home care facilities in Clackamas County. I'm assuming those are like adult foster care qualified in-home care facilities. Is that right?
There's over 70 long-term care facilities, so skilled nursing facilities, assisted living communities, et cetera. There are a lot more adult foster homes.
Okay.
So that's what our mobile vaccine team doing those homebound vaccinations are focused on.
Okay. I have heard rumors, and maybe you can tell me whether they're true or not. I've heard there's been huge outbreaks in some of our long-term care skilled nursing facilities. Can you either substantiate that or dispel it?
I would say since the beginning of the pandemic, yes, that those are congregate high-risk settings with a vulnerable population, and that's why having those restrictions around visitation, having family members meet with their loved ones outside is still has been a really important mitigation tool. There's been concerns with the healthcare worker staff that going to work sick and
Well, Philip, thank you for that, but
They're
I've heard of this more recently, within the last month, that many of the residents have been vaccinated, but yet there's outbreaks in these facilities. I'm wondering if you had heard the same information.
Yeah, I would say on an ongoing basis, we have outbreaks within these settings.
Okay.
Nothing significantly new to my knowledge. I would say long-term care facilities, schools, and workplaces of all types are really where we're seeing the source of outbreaks right now with our current cases.
Okay, thank you. We have a couple commissioners in the queue. Commissioner Fisher, you're up.
Thank you, Chair Smith. Philip, can you let us know what's going on with kids, and are things remaining stable for kids as far as getting COVID, or are they increasing, or are kids in the hospital, are they not in the hospital? I'm interested in comparing what we know is happening in other states to what's happening here in Oregon and specifically Clackamas County.
Not seeing severe illness or hospitalization increase for children at this time. Certainly, we are seeing an increase of spread of COVID within younger people, and that's to be anticipated with the increase of going back to school. And we knew that it would be a bumpy start with schools. I think overall, we've had some, exposures and some quarantines that have needed to happen in the first few weeks of school opening this fall. But certainly with our hundreds of schools that we have, I think we're doing a really great job with working with families and school staff and superintendents. I would say overall we're doing well and doing all we can to keep kids protected and safe from COVID-19, and also keeping kids educated and in the classroom.
Oh, good. Thank you for that. I'm really happy to hear that. I'll keep asking that question every time you come. Maybe you could put that in your report. Appreciate it. A few other questions. I appreciate Chair Smith's question about the PCR tests, the over-the-counter tests. How effective, I know there's the PCR test which takes a few days and the rapid test is immediate. How effective are the rapid tests?
Yeah, if you get a positive rapid test, we recommend you still get it confirmed with a PCR, one of those laboratory confirmed tests. So, those rapid tests that you do at home, those don't get reported. That's really a self tool to help you if you have concerns, and if if you have the resources to have one and want to have that assurance. If you do receive that positive test, we do recommend you get scheduled and get access to that PCR test because they are more accurate.
Okay, are there common false negatives on those tests?
I don't know about common. I'd have to look at that, but I would say it does happen where you have false positives and you have false negatives. So it does happen.
So it's basically not as effective as a PCR test, is what you're saying.
There's a lot of factors. You're self-administrating it, having to put the swab in your nose and then keep the sample protected. So it's certainly when you have the healthcare professionals doing it for you, I do think that is a little bit more reliable way to go.
Okay, well, I'm interested, you don't need to explain it today, but maybe next week, as employers move more towards, in alliance with the president's requirement for vaccination or testing, how that will be rolled out and what kind of tests, how often, what's the cost going to be, who's going to pay for that, how's that going to be administered? Because I do understand that Clackamas County, being an employer of over 100, will most likely fall under that requirement. Another question, I really appreciate the talk about natural immunity. Is it within the science, can people who've had COVID, can they go to the doctor and get an antibody test and know if they're immune?
I would encourage folks to certainly talk to their trusted healthcare provider. You can have some tests done to see how much antibodies you have for COVID. and that can help provide you with some information in terms of how much protection you could have.
Okay, so that is part of the science. That's good to know. And then you also mentioned that Clackamas County has 87% of its healthcare workforce that is vaccinated. Does that also include the people that work in long-term care facilities or nursing homes? Are they considered healthcare workers?
Yes, they certainly are. It's a very large group: nurses, physicians, pharmacists, long-term care facility staff, paramedics, on and on and on.
Okay, and I do know that a large part of the long-term care system is SEIU workers, which are having their vaccine mandate extended, I believe, 6 weeks or 8 weeks. Now I can't remember. I'm wondering, I'm sure you've been tracking the workforce for healthcare. Is there a concern that in Clackamas County, the vaccine mandates will hurt our service delivery systems for people leaving the workforce?
Yeah, I think that is a concern. I think that's a factor. I think fatigue and burnout from the pandemic are a concern, and it's all concerning. Our healthcare workforce capacity will continue to be a challenge.
Okay, do we know what the percentage of workers are expected to leave based on the vaccine mandate? Or are there
Every
any estimates?
organization is, including us locally here in Clackamas County, is working through the process, monitoring it closely. I think it's tough to come. I know it feels last minute, and it is, but it's going to be tough to know all the impacts until really we get really close to that October 18th deadline.
Okay, so we don't have any reliable estimates at this time.
I do not. That's why I shared that slide with how well Clackamas County residents who are healthcare, that so many of them are vaccinated. I think that's really compelling data that I am feeling more positive than I was before seeing that information, for sure.
Okay, I really appreciate that. I'm hearing anecdotally people getting vaccinated, which has been wonderful. Just a few stories because of the really the concern about workforce, and I'm seeing it as a positive thing. I do hear the concerns also about people concerned about being required, so it's a really important issue. Thank you, Philip.
Okay, let's move this along. Commissioner Schrader.
Yeah, Philip, I have a question about the booster shots. So Pfizer is approved. Are they suggesting?
Martha, can you speak into your microphone?
If they're suggesting, is there any information that if you've had Moderna, that you could get a Pfizer booster? Just kind of curious about that. If you can
at
mix
this point-
vaccines, yeah.
Yeah, makes sense. That question's coming up a lot. Folks who receive their first and second dose of Pfizer should receive that are 65 and older should receive the booster for Pfizer. If you receive Moderna, our recommendation is to hold tight in the next few weeks, that it will go through the same process. That's the way this has rolled out. Pfizer has gone through this process first, followed closely by Moderna and then Johnson & Johnson. So if you've received Moderna or Johnson & Johnson, please hold tight. They will be coming on board, I would expect, in the next few weeks, if not a couple months to come.
Right. My understanding is that Johnson & Johnson is not a vaccine, is not a messenger RNA vaccine. Is that correct?
That is correct.
And so it operates in a very similar way as other vaccines that people have gotten through the years in terms of giving them immunity or antigens. Does that make sense?
What was the question, Martha? I'm not sure you heard
I
that.
guess my thing is that some of what I've been hearing is that people are fearful with messenger RNA vaccines because they somehow think it's affecting their DNA, which it doesn't.
Oh,
However, Johnson & Johnson is not a messenger RNA vaccine, and so it's the methodology of development and how it seems to give you immunity is very similar to other ways that we have vaccinated people in the past.
Yes, that is correct,
Okay,
Commissioner.
thank you. So if people are concerned about the two newer vaccines, there's an option for them that is really following, that will give them, I'm just going to say, in my mind, I think it would give them some certainty and relief from feeling that this is something new and different. And that's probably more of an opinion than anything else.
Thank you. Commissioner Scholl, you're up.
Yes, Philip. For months, we've heard from people asking about why does my natural immunity after having COVID not get recognized as an option to get in a shot. The 13% of our healthcare workers that have not gotten a shot, they're not going to get one. Philip, could you go back to the Oregon Health Authority and ask them, what is it going to take to have these people recognized, to take the pressure off these folks that don't want to get vaccinated? I mean, of those 13%, some of them have had COVID, and they have the antibody, and they should be taken into consideration in this problem we have. Please go back. Maybe next week you can give us some more information on that. We can get this part resolved and thereby mitigate the tension that's out there at this time. That also goes for our jailers, sheriffs, firefighters, and everybody else out there who's in this situation. Thank you.
Thank you. Commissioners, I'm going to request that these really specific questions that really nobody has an answer to, that you submit them to Philip ahead of our business meeting, because I don't really think it's fair that we aligned Philip as the expert on this when he may not know the answers that you seek. If you seek those answers, let's have more thoughtful consideration in trying to get the answers ahead, and then you can ask the questions at the business meeting. One more commissioner, Commissioner Savas, you're up.
Yeah, I did do some research after Tuesday in regard to the line about the natural immunity, and went on the CDC website. I'm happy to share the links, but it's, I guess if I was to summarize what I read, not that I am no expert, but I would encourage people to go back and read that particular, or not go back, but at least look at the link. It's not a surefire or a resilient or a long-term preventative measure or situation status in which people are going to be prevented from getting Delta. So Delta variant will ultimately, when that natural immunity from the antibodies of someone getting COVID in the past is short-lived, in essence. That's how I interpreted the CDC's language on that.
Well, I'm just going to make a comment. No commissioner sitting at this dais are an authority, a medical authority, or a scientific authority on this virus or any other disease or virus that comes forward. So I'm going to caution us all for making statements as such. We will be considering a resolution dealing with workforce issues and the compassion that I believe we should extend to our 2,200 Clackamas County employees. With that in mind, Gary, what's up next?
All right, thank you, Philip. Next is a previously approved land use issue, adoption of a previously approved comprehensive plan and zoning and development ordinance amendments, ZDO 280, minor and time-sensitive comprehensive plan and zoning and development ordinance amendments. Nate Boderman from the County Council's office is here to give a quick update for you on this.
Great, thank you. Good morning, everyone. This morning, we're recommending adoption of an ordinance to implement the previously approved ZDO 280 proposal, which is a package of legislative amendments to the county comprehensive plan and the zoning and development ordinance, which would make relatively minor changes that are necessary to comply with existing laws, which would clarify existing language and correct errors that exist in the code today, and which would adopt optional provisions that required really only minimal staff analysis. Planning Commission held a hearing on this on July 26th of this year and voted to recommend approval of the package, the amendment package to the board, adding some amendments at that time. The Board of Commissioners held a public hearing on August 18th and unanimously voted to approve ZDO 280 as originally proposed by staff, but that proposal didn't include the specific amendments that had been recommended by the Planning Commission. So staff has gone ahead and drafted the ordinance for you today to reflect the board's decision that was made last month. And it's certainly staff's recommendation that you approve the ordinance materials, which serves to implement the board's decision that was made at the hearing last month. With that, I'm happy to answer any questions you might have.
Does the commissioner have any questions for the presenter on this? I will entertain a motion to read the ordinance by title only.
I move we read the ordinance by title only.
Second.
The motion has been made by Commissioner Scholl to read the ordinance by title only, and it has been seconded by Commissioner Savas. Any further discussion? Seeing none, Shannon, please call the poll.
Commissioner Fisher?
Aye.
Commissioner Scholl?
Aye.
Commissioner Schrader?
Aye.
Commissioner Savas?
Aye.
Chair Smith?
Aye, motion passes 5-0. Shannon.
This is ZDO 280, Minor and Time-Sensitive Comprehensive Plan and Zoning Development Ordinance Amendments.
Now, may I have a motion to approve?
I move we adopt ZDO 280, minor and time-sensitive comprehensive plan and zoning development ordinance amendments as previously approved at the August 18th, 2021 land use hearing.
Seconded.
The motion has been made by Commissioner Savas and approved by Commissioner Scholl. Any further discussion? Seeing none, Shannon, please take the poll.
Commissioner Schrader?
Aye.
Commissioner Scholl?
Aye.
Commissioner Fisher?
Aye.
Commissioner Savas?
Aye.
Chair Smith?
Aye, motion passes 5-0. Gary, what's up
Great,
next?
thank you, Nate. Next, we have a presentation. The month of September is Suicide Prevention Awareness Month. Gally Murray from Health, Housing, and Human Services and our Suicide Prevention Coordinator at the county will present. Go ahead, please, Gally.
Good morning. Shannon, is it possible to bring the slide deck? Oh, there it is. All right. All right, good morning.
Please introduce yourself.
Yes,
Thank
of course. So I'm Gally Murray, and I'm the Suicide Prevention Coordinator for Health, Housing, and Human Services. Thanks so much for having me here today, and wonderful to see most of you again. We spent the evening at the town hall last night, so good to see you all again. In honor of September being Suicide Prevention Awareness Month, thank you so much for having me here today and creating space to talk about a significant public health issue. We're going to start with a brief review about what we know. So next slide, please, Shannon. We believe that suicide is preventable. We know that many factors lead individuals to try and end their lives, and that it rarely occurs because of one thing. We know that suicide attempts rarely occur out of the blue, and that the moment when someone takes action is oftentimes during a brief period of heightened vulnerability. One of the most powerful risk factors for suicide deaths is the ready available of highly lethal means, such as pills or firearms. This is why putting time and distance between someone who is struggling and lethal means can save a life. We also know that 9 out of 10 people who attempt suicide and survive will not go on to die by suicide at a later date. This is why getting people support and infusing them with hope is absolutely crucial. Next slide, please. Here's what we know about our local data. Over the last 10 years, just in summary, over the last 10 years, deaths from suicide in Clackamas County have continued to increase. To drill down a little bit on the graph that you have in front of you, what we know about this specific data over the past 10 years is that the 45 to 64-year-old age range are the folks that are dying the most in our community, followed by the 25 to 44-year-olds, followed by the 65-year-olds and older, followed by the 10 to 24-year-old age range, which is dying the least amount in our community. Next slide, please. Now that you know a bit about the data, it's equally as important for us to talk about the work of prevention. The work of suicide prevention, like most prevention activities, is oftentimes invisible and not always easy to see. I'm going to spend some time focusing on the incredible and life-saving work that goes on behind the scenes here in our community and in our county. One example of this effort is we provide universal screening for suicide risk at all of our primary care, behavioral health care, and urgent mental health walk-in clinics in the county. No matter why you present for care at any of our clinics, we are going to ask you about thoughts of suicide. This upstream prevention strategy is similar to when we go to the doctor or even to the dentist and they take our blood pressure, which is also an upstream prevention strategy for things like heart disease and stroke. Asking about suicide allows us to support folks who might otherwise fall through the cracks. We ask how they're doing and how we can help them. It also signals to our community that we are prepared to talk about suicide and that our clinics are a place where you can receive this support. H3S recognizes that we are uniquely positioned to do this work given the population that we serve. This slide speaks directly to the work that has occurred in one of our primary care clinics thus far in 2021. So nearly 22,000 people presented for care at one primary care clinic thus far this year. And out of the 22,000 people that presented for care, a little over 19,000 of them were asked directly about thoughts of suicide. There's an error in your slide, in this slide, that says 21,000 people were asked. It actually should say 19,000 people were asked, 22,000 people presented for care. So this 19,418 individuals, these were 19,000 folks that did not fall through the cracks. They were asked directly about thoughts of suicide based on what we're doing in our clinics and thanks to our staff. Next slide, please. Additionally, we offer technical support and consultation to our community partners to be more intentional about preventing suicide. These are just a few of the county and community partners that we have actively supported in this work. Our own Human Resources Department, our own Sheriff's Department, and definitely our school districts, which we have 10 of, and we actively support them. Next slide, please. Our colleagues in the juvenile department, law enforcement agencies, domestic violence agencies have made a commitment to training staff because they know that risk of suicide is high for individuals who have contact with these particular systems. Our colleagues in Lake Oswego took their police force offline for 2 days to send them through ASSIST training, which is the gold standard for suicide prevention training, and it is 2 days. It is a huge time commitment, and Lake Oswego Police took their folks offline, put them all through ASSIST. They truly believe that part of their role as first responders is to identify signs and symptoms of folks who might be struggling and to get them help when they need it. Our school partners have also made this commitment. Each of our 10 school districts will train all staff. I will emphasize that again. Each of our 10 school districts will train all staff in suicide prevention, as well as develop a suicide prevention, intervention, and prevention protocol. Next slide, please. Additional suicide prevention efforts in the community. The Clackamas County Coalition to Prevent Suicide formed in 2018, and it is a community-driven group of individuals, professionals, suicide loss and attempt survivors, and others who are interested in guiding recommendations specific to suicide prevention in this community. As a result of this coalition, a partnership was established with our county dog services, as well as with VCA Northwest Veterinary Specialists. Any of you who own pets know that those are the folks who own Banfield Hospital and VCA clinics. They're a big institution. The partnership came about because we know there's an intersection between suicide and animal shelters and veterinarians. We know that veterinarians are at higher risk for suicide, and that on occasion, people planning to die from suicide may actually surrender their pets to a shelter or actually seek euthanasia for a healthy pet, a well pet, prior to their death from suicide. This partnership focused on creating additional awareness and offering suicide prevention training to all of these establishments. It was largely successful. Additionally, our Clackamas County Suicide Fatality Review launched in May of this year. We're incredibly proud of this partnership between H3S and the Medical Examiner's Office. And this has brought together dozens and dozens of community partners in our community to better understand the factors that may have contributed to someone's death from suicide. So this review happens after someone has died. We get permission from next of kin to gather this information, and we take a deep dive into what were the system barriers for folks to accessing care that may have contributed to their death from suicide. This information will allow us to better inform prevention efforts in the community and countywide. Next slide, please. Other efforts in the community include what we refer to as post-vention supports. What we know, the research says that the risk of suicide increases for someone who has experienced a death from suicide in their life, and as a result of this known fact, our behavioral health division partners make post-vention outreach calls. So again, I'll repeat that when we know that someone has had a loss of someone they care about or know, and it doesn't have to be someone who's really significant in their life, someone who you have an emotional connection to. If you've experienced a loss of suicide, you are more at risk yourself of suicide now. Think about like when Robin Williams died from suicide. Many of us, I was raised on Mork and Mindy, and that was a loss for many of us when Robin Williams took his own life. And what we saw nationally is that suicides went up, attempts went up, calls to national hotlines went up. So my point in saying that, the person who's connected, you don't necessarily have to have known this person to have had an emotional connection to be impacted by this type of information. The Behavioral Health Division makes postvention calls for 4 reasons, and they're listed on the slide. And mainly, we know the complexity around suicide grief is can be incredibly difficult. So the Behavioral Health Division postvention team creates space to hear about those emotions and holds space for our community members who are grieving. The second reason why they call is to let people know in our community that there is resources available to them if and when they should need, including walking into our own mental health urgent walk-in clinic free of charge. It's the only service that clinic offers free of charge. We don't care about insurance. We don't care about household income, because we want it to be as barrier-free to get people in there and to get support if and when they want it. The third reason why our folks make these calls is to ask if there's anybody else who might need support. This team has called as far as Australia because we know that the ripple effect of suicide can be significant. And last but not least, because we know the risk of suicide can be incredibly high for people who have experienced a suicide in their life, we ask the question, it's not uncommon when you lose someone to suicide to have thoughts of suicide yourself. Have you had those thoughts? So we are triaging for risk in those calls. To give you a sense of how many calls are being made by one staff in 1 year from this team, for a total of 39 deaths that this staff followed up on, the staff made 63 calls. So we know that the ripple effect is significant, and that for every single death that occurs, many, many, many people are impacted. And our job is to get them services and support, and to let them know they're not alone. This work of postvention is unique, and it's being looked at by others, both in the state and the nation, as leaders in the work of postvention and the work that we're doing here in Clackamas County. Next slide, please. Here's where we ask for your continued support as leaders. We need to continue to be intentional about this work. Funding this work, keeping it a priority, is what we need. When we know individuals are at risk of suicide, we need to be intentional about getting them support, care, and resources. The work of suicide prevention, as I said last night in the town hall, is all about being intentional. We have to be intentional about this. The rate of suicide is not just going to go down. Just like when individuals are diagnosed with something like diabetes or asthma or another physical health condition, when folks are diagnosed with asthma or diabetes, we put those folks on a plan of care, or they get a treatment plan. We're very intentional about getting them support and services to care for diabetes or asthma or whatever the physical health condition is. Suicide should be no different. We have to get people on a plan of care, have to get them support. We have to have conversations about it. By just talking about it, by us being here today, we are being intentional. These are the conversations that change the way people think, that change the way that people get involved, and ultimately save lives of our community members. This work belongs to all of us, and we need your help in continuing to shift this thinking that it belongs to mental health providers, because it doesn't. It belongs to all of us. Everyone has a role, everyone. This starts by taking a suicide prevention training. This starts by creating additional awareness, and this starts by talking about it. Thanks so much for your time today and for making this work so intentional.
Thank you very much, Gally. Any questions or comments for the presenter? Last night, we had a listening session and invited the public to attend. All commissioners were present. We had a panel of 3 experts, of which Gally was one of them. It was well attended, and I really appreciated the information, the outreach, and the resources available to help folks. Commissioner Fisher, you're up.
Thank you, Chair Smith. Gally, thank you so much for being here and for all the incredible work that you do. I'm interested, I've read some articles about efforts around the country. You had talked about access to a means to end your life is it's I don't know what you call it, a factor in the success, I guess, of ending one's life. And you had mentioned pills and firearms. Can you explain a little bit about the efforts nationally that I've heard of gun owners working on prevention efforts, and just tell us a little bit more about that.
I would love to. Thanks for the great question, Commissioner. So to go back to the data, what we know nationally and on the state level and here on the county level, approximately a little over 50% of all suicide deaths include a firearm. Next, following that, are typically pills or medications, and typically after that, we see asphyxiation such as hanging. When we talk about suicide, we know that more often than not, suicide, and I use the word more often than not because there are outliers, more often than not, it is a very impulsive decision. There's a study that was done quite some time ago nationally that says 70% of people who took action to try and end their life made the decision, and these people obviously survived, 70% of these people made the decision to end their life and acted upon that step in 60 minutes or less, an hour or less. Yeah, the look on your faces, right? It's we don't know this, but it is, and again, that's only 70%, there are the 30% that take longer. But my point in saying that is if there is access to lethal means, and we know that in the case of the most lethal way, guns are the most lethal way to die. 9 out of 10 people who pull a trigger will die if they use a firearm, compared to rescue rates coming with pills or even with hanging. So what we know that putting time and distance between someone who might be struggling, and we know who those populations are. We know that our older adults are more at risk. We know that our young folks are at risk, our veterans. We know that folks who experience a severe and persistent mental illness, the list goes on and on. We know that for folks who are vulnerable, having access to lethal means during a height of that kind of extra vulnerability can mean death. So to speak to your point, Commissioner, there are efforts happening nationally and on the state level, and to some extent at the county, we're beginning conversations of involving gun owners and the gun community in these conversations. That previously, suicide prevention has historically left the gun community out. And people who own guns want to be a part of suicide prevention. And we have historically not included them at the table. And we like to politicize guns. And there are a lot of political things that come with guns, but at the end of the day, we can all get behind we want to save lives. It doesn't matter if you're a gun owner or not. We can all get behind that safety is important and that saving lives is the number one thing that we can all get behind. And so there are things happening at the state level around finding temporary storage for people who have firearms in their home, and perhaps they have a family member who's really struggling, and they want to temporarily have the firearms out of their home and want to get them back. They don't want to give them up. They want to get them back. Wrap up.
Thank you very much. Please be brief in your comments. We have a lot of work to do ahead of us.
Okay.
Commissioner Fisher,
Oh, no.
are you finished?
Yes, I am. Thank you.
Thank you
President.
very much. Thank you, Gally, for coming forward.
Thanks so much for the time. Appreciate it.
Gary, what's up
Yes,
next?
thank you again, Gally. Next is a board discussion item, a draft resolution in the matter of addressing the inadequate workforce that delivers health, safety, and emergency services. Commissioners, you have discussed this at your Tuesday work sessions earlier this week. There is a revised draft that was presented to you for your discussion today. Chair Smith, would you like to kick this off?
Certainly. And Commissioner Savas has offered up some language, which I think is quite good. My reason behind offering up a resolution that deals with our workforce, I do feel some sectors of our workforce have been overwhelmed, mainly our public safety folks in all arenas and our healthcare professionals have been really have been our heroes. There's a lot of political issues around what governments are doing, but what I wanted to do is offer some solutions to help mitigate the effects of our delivery system and our public safety system. And some of the considerations, and I'm going to read from the resolution, and all the commissioners have a printed copy. If anybody wants one, you can get it online. The Board of County Commissioners requests that the state of Oregon reevaluate its terms of the vaccine mandate to consider all options and alternatives that could prevent further exhaustion and departure of core public service providers. Number one, extension of the deadline to be fully vaccinated. Number two, regular COVID testing. 3, offer a religious exemption 4, offer a medical exemption. And finally, recognition of effective proven technologies in the workplace to combat and possibly prevent Here in Clackamas County, I believe we were one of the first counties to do a test case on monoclonal antibodies for the treatment of COVID. It was done in our public health clinic, Providence Hospital. In my conversations with them, we're very happy to see that, and they are doing it as well in clinics and hospitals. And that is designed to alleviate and relieve the hospitals of capacity to, because at times they've been overwhelmed with just not COVID patients, but with other patients as well, mainly due to a shortage of workforce. A lot of our nurses are retiring and they're quitting, and I find that very disheartening. But I understand why they're doing that. The Board of County Commissioners will also advocate that the Oregon Legislature take action that allows for easy, transferable licensure agreements between the states, so traveling healthcare professionals can come into Oregon, and they are all over the country, but for some reason, Oregon's law is very preemptive in that. And so let's get the people in Oregon who want to provide healthcare an opportunity to do so. And fourth, the Board of Commissioners encourages our governor to engage in listening sessions with the business community and public immediately to hear directly about workforce issues and concerns related to the pandemic from our shared constituency. And then after this was written, the governor extended an invitation to all county commission chairs throughout the state. On Monday, we have a Zoom call on workforce issues. That's all I know. I asked her staff. Recently, there was a newspaper article that came out that the state of Oregon is now allowing 24,000 state workers an extension on their deadline for the vaccine. And that's all we're asking. We're asking for some care, some time, some compassion to allow these people to make a decision on what they're going to do with their long-held careers. And there's very strong opinions on both sides. We know that. Here at Clackamas County, we have provided vaccines. We have gone the extra mile. But you have to remember something about our county. We are as a diverse county as the state of Oregon is diverse. Clackamas County is probably a snapshot of the entire state, all encompassed in one county, of 1.2 million acres, 16 different cities, rivers, streams, huge urban areas, isolated rural areas, and all of those communities are as different as you can get. So as leaders, we are trying to make our healthcare decisions wisely. We are offering up what we can, but we're also recognizing there are people with differences, and we are very dependent on a workforce here at Clackamas County to keep our county not only safe, but healthy as well. And so now I'm going to offer up Commissioner Savas. You had, I think, some good language. Would you like to talk about that?
Sure. Thank you, Chair. Yeah, we've come a long way on this resolution. It certainly has changed significantly, and I would encourage my colleagues to point out anything that they see currently or don't like in there currently. I came in this morning, I read it very thoroughly, and I'm going to go all the way to the top to the title, and which is what I've got some suggested language. I'll give you a copy of that. I'll just read, as it currently reads, it reads at the very top. In the matter of addressing inadequate workforce that delivers health, safety, and emergency services. And I'm proposing language that reads, in the matter of recognizing the overwhelmed workforce that delivers critical health, safety, and emergency services. So that's my suggested language for that one change. We've come a long way. I think that in the therefores, as Chair Smith kind of outlined and read, I think they're consistent with state and federal actions, policies, whether it's the president's policy or the governor's policy or changes or adaptations and adjustments that have been made. So I just really just want to make that suggestion and again encourage anything in here that you don't like. We just air that. But I think we're in a again, we've got a completely different revamped resolution here that I think I can get behind.
Thank you, Commissioner Savas. I'm not going to say it's been completely revamped. We took out some things and added a couple others, but Commissioner Fisher, you're up.
Yeah, thank you, Chair Smith. Commissioner Savas, I appreciate the title of what you're suggesting. I do think, however, if that is the title, then the supporting documentation should support that. And I don't know that these whereases do that. I think that what Philip had said regarding burnout, fatigue, stress of our workforce is a very important aspect that should be recognized. Also, that 87% of our healthcare workforce is vaccinated. I think that the message of this being the language in the fourth whereas, it says imposing vaccination mandates, is language that could be changed to requiring vaccinations for certain sectors, I think is important. Also, in that whereas, it talks about public safety, but at this point, public safety is exempt per state law from requirements to be vaccinated.
Is it? I did not know that to be true, Gary. Stephen?
That is correct. ORS, I think it's 433 exempts from vaccinations as a condition of employment, healthcare workers, law enforcement, broadly defined, unless a statute or rule dictates otherwise. And how healthcare is being included now is with the OHA rule stating that you have to be vaccinated to be if you're a healthcare worker, you have to be vaccinated. Does that make sense?
No, it
Okay.
doesn't, because I'm going to tell you why. And one of the reasons for this, Commissioner Fisher, is the sheriff's deputies that work in our jail are being required to be vaccinated.
Well, that's
So therefore,
because
they
they're
are not
healthcare,
exempt.
Because they go
No, they're
right-
not. They're sworn deputies.
No, I understand, but the reason why, because I've looked at this, is because they are in such close proximity
Mm-hmm.
to the healthcare delivery in the jail.
Well, I'm not,
Can I just continue with my, we can come back to this. The other piece that's so, and I'm right with you, Chair Smith, on what's happening with our folks that work in the jail, and like we talked about at our policy session, very concerned about the messages that our workforce has received, very concerned about the timing of things. So I think that the requirement, it's the timing of, not the requirement itself, that will result in the loss of employment and income to Clackamas County families, causing further hardship. I think it's the timing and the lack of flexibility. Because honestly, if somebody has had COVID, they need to have enough time to go to their doctor, get advised, and to see if a medical exemption is appropriate or if the vaccine is safe for them individually. I am very concerned about the timing. The other piece that I'm concerned about, we talk about, whereas the Board of County Commissioners recognizes that another shutdown, and the language here says, due to the lack of workforce, but that is maybe, it's not due to the lack of workforce, it's because of the continued spread of the virus or the mutating of the virus that is a critical piece. It's not only because we lack workforce in healthcare. But that being said, needing to incentive, looking at that workforce issue, if we're going to be having this be a resolution of recognizing the overwhelming workforce that delivers critical, our suggestions, we should talk about that specifically and what we would suggest to further incentivize workforce. Also, I just want to state again, if we're really looking at our workforce, what Philip had said about the stress, fatigue, and burnout, and a lot of that is due to, you hear Dr. Esquire Sharon Myron, Commissioner from Multnomah, talk about the fatigue because of the overwhelming people coming into the hospital system being unvaccinated and requiring care is overwhelming. That in and of itself is a huge part. So our continued effort to get ahead of this virus and stop the spread, I think, is really, really important. As for me, what I am doing is connecting with the governor's office directly regarding increased flexibility and timeframes. Really, we need to look at things individually and allow people the time that they need to be vaccinated. Regardless of what we do today, much of this has been resolved with the governor extending by 6 weeks, which should be recognized and acknowledged if we are going to do a resolution. And then finally, the president's requirement that's coming from the federal level will supersede all of this in the employers of 100 or more, of which many in these sectors are. So that is my suggested feedback to this resolution.
Commissioner Fisher, I take some disagreement in some statements that you've made today. We have been considering this resolution for 2 weeks now. We offered something up on Tuesday of which all commissioners had opportunities to submit your changes, and you did not make those submissions in a timely manner to take into account this. I am absolutely not willing to strike public safety from this, because this is one of the reasons that this resolution has come forward. We don't know for sure the effect of any federal mandates, because right now there's at least 20 states fighting that, and I believe it will be held up in court for a very long time. We don't know exactly what our governor is going to say to us on Monday, and I offer this up, the reason for this resolution, so our governor can consider that this is coming from a county with the third largest population in the state, our most diverse county. The governor and I have a very good relationship on these things, and I do think if she sees this, she will work on that. Due to a lack of workforce, I think that is critical, and I have brought those issues forward again and again and again, because I think this board needs to consider the seriousness of that. The extension of a deadline, whereas it has gone to state workers. She has tried to impose restrictions on county workers. I do not see any of that going away today. I do like the language that Commissioner that Commissioner Savas has offered up. And I'm confused really about the language that in the last whereas, due to lack of a workforce. This is exactly what we're talking about, the title, the new title that Commissioner Savas has proposed, an overwhelmed workforce that delivers critical health, critical safety, and emergency services, that we need to pay attention to that particular workforce as we go forward. Now, they may decide to get vaccinated later on, that's fine, or whatever, but I think the time frame is essential. I think these workers not long ago were hailed as our heroes. Now we are vilifying them and treating them like scoundrels, and I don't like that whatsoever. And I'm sure we're going to have more discussion on this. Commissioner Savas, your light is on.
Yeah, thank you. So I appreciate Commissioner Fisher responding to my request to what don't you like. I was just kind of wondering how we find a constructive way. I came here today with a constructive way of getting to a good place. And the title change, I'm going to repeat it again, the title change, I think is something that changes the why. Why are we doing this? And I'll read it again. In the matter of recognizing the overwhelmed workforce that delivers critical health, safety, and emergency services, they are overwhelmed. Mm-hmm. They need our support, regardless of their vaccination status, regardless of what they think. They need our support. I say thank you to everyone I know that's either a doctor or any of the emergency responders, and they appreciate that. They are overwhelmed. I have one family member that's so overwhelmed that she is actually considering getting out of nursing because it's so bad, and she resides in California. So if that's the why, then great. As to the lack of workforce, that last whereas, let's talk about that. I've said since this COVID outbreak that I agree with the state and the governor's concern about hospital capacity. And hospital capacity is beds, it's workers. The governor called in the National Guard because of a lack of workforce. So it's consistent with everything that's happening. This is not, these are, the W's, the who, what, why, where, when, right? These are whereases. It's not the whys. It's not the who's. It's really, so whereas, I think, as I understand it, I think these whereases are recognizing those folks and recognizing the situation, and I think that I can't find anything that's contrary to state or federal policy here, frankly. But I would certainly, I'm not an English major, so I would ask, my colleagues for their opinion on this revised language. But again, I think that the why is the language change here. I want to recognize them. I want to recognize everyone that's dedicated their life for the health and safety of others.
Thank you for that. Commissioner Scholl, you're up.
Yes. We can pencil whip this thing until the cows come home. We've talked about it. We've got a revised resolution here. I move that we adopt this resolution with Commissioner Savas's title change, get it signed today, and sent to Salem.
I'll second the motion. Further discussion, Commissioner Schrader, you have your light on.
Yeah. So I have wrestled with this issue, and I want to thank my colleagues for putting something together that has been moderate and more reflective of your intentions here. And I think that it is possible to send this reasonable message, but on a personal level, I still can't get there. So I'm going to tell you, I won't be supporting this today. And here's why. I think the whole issue that we're dealing with here is that the word mandate. And I think it's unfortunate that that's kind of what the discussion has become about mandate, instead of what I call community responsibility to one another as brothers and sisters and citizens, and the notion from my perspective that it is a community responsibility to be vaccinated. And to the folks that say, well, it's experimental, again, one of the reasons I brought up J&J is because that is a similar vaccine to all the other kinds of vaccines that we have received in our life in terms of how it operates within our system. So you do have a choice. If you're concerned about the notion of a messenger RNA vaccine, there's a choice out there that you could take. I feel very badly about this because I respect my colleagues and I want to get there. And I think you've gone a long way. But I just hearken back to 1918 again, where I guess they use the same word mandate, which I would replace with a community responsibility to get a vaccine, where that really was the tenor back then. And I wish that we could get back to that tenor of getting vaccinated because it's a personal responsibility for the good, for the public good. So thank you for this. I thought I could just abstain from this, but I just can't get past the fact that people really need to rethink this notion of a state mandate. And I would call on our political leaders, of which I am one, that maybe we need not to use the word mandate. We need to think of it more as a responsibility to one another. So, but I do want to recognize the work of Chair Smith and and Commissioner Savas and Commissioner Scholl in putting this together, because you have moderated it, you have compromised, you have put out something that some of the best language I've seen on this matter of mandates compared to any other counties in the state of Oregon. So I want to respect that and say that to all of you. Okay.
Commissioner
you.
Savas, you're up.
Yeah, I think it's extremely important, if this is a worthwhile exercise, that this be unanimous. And if it's not, then I would appreciate some suggestions that get us there. And if it's just to strike that whereas with the word mandate in there, just strike that altogether. I still think that the resolution works. But I think if it's not unanimous, then it's going to send the wrong message. It's going to be a political football, and I'm tired of politics. I'm exhausted. This is about people's lives, for crying out loud. This is about the people that are putting themselves on the line, and that's why I deliberately changed the language to recognize those folks. And if we can't do that, if we don't believe that, then it's a sad state of affairs, folks. So I'm asking you, how do we get there?
Well, I'm going to say something right here. As a leader of this commission, I have given and given and given and given and compromised and compromised and compromised and compromised, and I don't see it out of either one of you two. What I see out of you and out of you, you have dug your feet in and you are determined to take this down and not support our county workforce. And yes, I'm angry. Yes, I'm speaking from emotion today. But I have given. And how many resolutions have been presented to this board that I did not bring forward? I had so much pressure from a constituency that both you two represent, by the way, from other counties, and I've had citizens in this county to bring those forward, and I said no, because I didn't think we could get there. But I see what you people are asking the chair, to continue to compromise, and compromise, and compromise, and you two have not offered up anything. Commissioner Scholl.
We have people in this county who are living with tension and fear and anxiety over the potential for losing their jobs. They are looking for some act out of this board to send to Salem to relieve that anxiety. These people who we are talking about in this resolution are some very fine, hardworking people, and we need to protect them. This resolution will send a signal to Salem to do just that, and I urge, I politely ask all commissioners in this board to just please sign this today. Let this go to Salem. Let this be something, a voice from the people of Clackamas County to the governor. Thank you very much.
Commissioner Fisher, you're up.
Thank you, Chair Smith. I believe that all of us care deeply about our employees, our constituents, the workforce. Like I've stated publicly, I was very concerned about what our jail deputies, the timing, and the lack of flexibility, of which I am taking personal action on. So I want to just reiterate that. I don't think there's anybody on this commission that doesn't care. I just believe the message that we need to be sending is about reducing the spread of the virus by following public health protocols, while of course being humane and looking at people's individual needs and requirements. I want to remind everyone, we have a pretty incredible Public Health Advisory Council. I did send this resolution to the chairs of that, and the response I got was to please continue to support the public health protocols, and we are happy as an advisory council to advise further with more time, which I think is really critical when we are talking about our health workforce. We can really use the advice of the experts that are part of our Public Health Advisory Council. So I would suggest that as well.
Nobody has said anything to the contrary of that, Commissioner Fisher, and that allegation is false.
I did not make an allegation, Chair Smith.
Yes, you did, because I'm going to remind you, this is not a health care resolution. This is a workforce resolution. If you want to draft a health care resolution, I suggest you spend the endless days and hours that I have done on that, and you bring it forward yourself. Commissioner Savas.
Yeah, well, you touched on something I was going to ask Commissioner Fisher, and that, what is it that you see that's contrary in here? Because
Well, I went-
I'm flexible. I'm trying to get this across the finish
Travis,
line.
I wrote out all of my concerns. I stated them.
But I'm asking for what's contrary, what's constructive that gets us there.
The overall message, your title is great. If the resolution matched your title, I'd be good with it. Because I am all in support of this.
So would you be able to proffer something?
Commissioner Savas, my advocacy on this issue is talking to my fellow commissioners, is talking to the governor's office, talking to fellow state representatives. I am concerned about what's happening right now, and I am taking action to advocate for the people of Clackamas County. I don't think a resolution that does not have a message that we all can get behind is a useful exercise for us to pursue at this time.
But yeah, with all due respect, I think the chair has, to her credit, has invited those suggestions and changes. And I was hoping that we would all do that to get in a better place. So I want to just acknowledge that the chair's passion here, I mean, she's been flexible. She has compromised. We're all here to compromise to get to a good place. If the workers out there that we're trying to recognize don't get that from us or don't deserve that, then that's a sad state of affairs. So
I don't think that's.
okay, then if we had, I'm asking how we get there. How would we write a resolution that speaks to recognizing the overwhelmed workforce that delivers critical health, safety, and emergency services?
I think then we focus on that, and one of the key reasons why our workforce is overwhelmed, especially if you're talking about healthcare, is the misinformation campaign. And Commissioner Schrader has talked about it, and I've heard reports about it, that a lot of this information is coming from outside of even this country of an effort that causes disruption. That is a big piece.
That's a why we
No,
can't
but
control.
that's a big
why we
piece
can't
of
control.
why our healthcare system is overwhelmed, because this is a pandemic of the unvaccinated. So our message should continue to be the public health message of vaccines, masks, social distancing, and doing that because there are many people that cannot be vaccinated, namely our children.
I don't want to see a split vote because I think that's going to hurt
Well, Commissioner Savas,
hurt the morale, frankly, of
I
all
don't-
those. So therefore, I move the table.
Commissioner Schrader is in the queue.
I just want to say something, folks.
I can't hear you, Commissioner, I'm
Okay.
sorry.
Okay. First of all, Chair Smith, I'm okay if you're mad at me. It's all right. You have reason to be mad at me. I just can't get there, and hopefully we're good enough friends that we'll patch this up, the way we usually do, because we've done it multiple times before. So, and I do want to acknowledge your ability to compromise, and I have been absolutely pleased to see you be such a solid leader for this county. I really mean that. I'm not just saying it to schmooze, okay? Because I don't do that kind of stuff. I really respect you. I wish I could get there. I can't. So we either will have a split vote, which I think is okay. So what if it's a split vote? Who cares? Or we can just table it and just recognize that we have differences of how this should be handled and that we have discussed this as a body and that there are differences of opinion on this, and not because we don't want to be supportive of one another or workforce. So what would you prefer to do? Paul, you think it'd be better just to table it, but I say if I support that, then we've all said what we need to be saying about this, and then we're done. Or let's do a split vote, and you've done a great job, as I said, making this one of the more reasonable things I've seen. So Commissioner Savas, what do you think? Do you want me to second the table? I mean, I can do that if you want me to.
I don't want to send the wrong message out there. I don't want this to be a political football. I'm flexible in taking out language that is somehow, deemed or perceived or whatnot.
So
And
you
if
wanna
Commissioner Fisher
continue-
wants to write a resolution that gets to something different than why we're here today, I'd be open to looking at it. If we don't want to recognize the workforce, then again,
Okay.
a split vote is going to send the wrong message. I can't get behind that. So if
By
that's
the
if
way,
that's the case.
as chair, I'm going to interject here. This board has had split votes before.
Yeah. We're okay
And when
with
this
that.
county, a long time ago, decided to go to a 5-member commission, it was designed knowing that we would have somebody in a disagreement and somebody in agreement. This commission was not set up for unanimity on any votes. It happens all the time. And I think that bar is artificial, Commissioner Savas. And if this fails today, certain members of this commission have sent a message, I believe, to our workforce that is detrimental not only within the county, but of employees who are not within our county purview. I'm perfectly fine with a split vote. I have not heard any considerable criticism of language in here. I think there's an opposition designed to defeat this, and that is a very, very sad day in this county. Commissioner Scholl, you're up.
So,
Commissioner Scholl has some comments.
sorry, Chair.
All the commissioners had the opportunity to provide input to this resolution. Chair Smith, in a sensitive way, considered all of our input, and it resulted in this document. She had to compromise. We all had to compromise. This is already a compromise a product of everybody's input. And therefore, I ask all commissioners today to compromise and adopt this resolution.
Commissioner Fisher, you're up.
Yeah, thank you. I'm going to go ahead and second Chair Savas's motion to table because I do think this has become a political football, and I don't want our county to be part of that. I'm going to ask Commissioner Schrader and anybody else who wants to join me in just issuing a statement that we can either give on Tuesday or next Thursday, just to say that we do support our workforce and we are going to continue to advocate with our legislature and with the governor for additional flexibility when it comes to vaccination for individual circumstances.
Commissioner Schrader?
Oh, yeah, I really think at this time I'll be honest with you, I think we just need to vote.
I can't hear.
I think we just need to vote because I feel like we're in an impossible situation with this. On one hand, we have colleagues that have compromised and written really, I would say, good language. I just can't get there because I truly believe that the vaccine is the way out of this, no matter what vaccine it is. I don't like the word mandate. I think it's been mismanaged from the get-go, and it should be community responsibility. Okay, and so when you have government coming down and saying, you got to do this because I'm Big Brother, I understand how people feel about that, okay? And that's what we're trying to get around. We're trying to say, look, government, stay out of my body, stay out of my business, that's all understandable. But I cannot get over the medical fact that the vaccine, everything else that is in this document is extremely reasonable. The notion of extension of the deadline, regular COVID testing, religious and medical exemption, proven technologies, all of these are part of our public health plan. The thing that in the end for me, and I frankly walked in here kind of going back and forth about how I was going to vote today. But in the end for me, okay, look, in the end it's like the vaccine, and there's multiple vaccines that will do the same thing. And if I have tomatoes thrown at me because it's going to be perceived that I'm not supporting the workforce, then I'm willing to take that. But by and large, I would like to see this voted up, even though I can't get there because of my personal notion that get vaccinated. Because I think it is the most reasonable language that I have seen, quite frankly, pulled together. So I don't think, I agree with the chair. Look, it doesn't matter if it's a split vote. You're right. We had 5 commissioners. So we can get our word out. And I'm okay with people being upset about it with me.
Well, you know, Martha, I think you need to take yourself out of this equation and your personal feelings about people, whether they're mad at you or not. It's not about you. It's about the workforce of the hundreds of people that I've heard from. And that's what I think we're elected to do, to serve the people who bother to take the time and send us the emails. I mean, I'm getting emails that you could make books out of on this topic. These people are intelligent. They are not stupid little puppets who have got my attention on this. And for this motion to fail us, to slap them in the face. And I'm sorry that you can't see that. I'm ashamed. I have never been ashamed more in my life than this commission thinking that we have to have a unanimous vote on something where the entire state and America is split, and you think we're not going to be split on this?
Thank you, you're right. Absolutely correct. We are going to be split.
And the motion that was made to have a unanimous vote to table this is insane. Absolutely insane. Commissioner Savas, you're up.
You know, this issue has divided too much of our state and our country. And the enemy is not ourselves. The enemy, as I said before, is this virus. And I do not want to send, frankly, a mixed message or a political message as a result of the vote here today. And that's what's going to happen if it's split.
No, it's not, Paul. I disagree.
Chair, if I could just finish. And so I'm not going to be able to support something that I sense today is not going to have a vote that's going to be, it's going to be political. You're right. It's not about a matter of being unanimous. It's really about the likelihood that this is going to be political. And to make the careers, to make the livelihood, to make the victims, the families, everyone that's impacted by this virus, to make this a political, potentially a political football, is frankly, it's wrong. It's absolutely wrong. Can we just think about, frankly, the humanity of this, frankly? All right? That's what's missing.
I disagree. This is designed exactly to support the humanity and the people out there. I totally disagree with this. Any other comments from commissioners at this point?
Chair, just point of order, there is a motion for the table and a second for the table.
Okay.
That's nice.
Okay. Is there a second to table?
Yes, Commissioner Fisher made the second.
All right.
Would you like to call for the vote, Chair? Or?
No, I'm not going to call for the vote.
Chair,
If this commission wants to overrule me, then you overrule me on calling for the vote as well.
Chair, I call for the motion.
And what is the motion? Somebody repeat it.
Move the table of the item.
Second.
It's already been seconded, Commissioner Fisher. I'm asking for a repeat of the question presented.
I need some help with Robert's rules. This is new to me. Gary's got it.
I got my cheat sheet, but it doesn't say what happens if the chair doesn't want to call for the vote. So what happens? The assembly can overrule the chair, so that means that at least 3 of you have to ask for the vote.
Correct.
Okay.
So are 3 of you willing to call
Yes.
for the vote?
I think
Yes.
we have to call for the vote.
So
I
I'm
think we
hearing
need to
Commissioner
put- I
Fisher,
think we
Commissioner
need to-
Schrader, Commissioner Savas.
Call
yes?
for the vote of the motion,
Of
motion on the
the
table
motion to
currently.
table.
Yes.
All right, so 3 commissioners have overruled the chair. So Shannon, would you please call the poll on the motion to table?
Commissioner Schrader,
Aye.
Commissioner Savas,
Aye.
Commissioner Scholl,
No.
Commissioner Fisher,
Aye.
Chair Smith.
No.
Okay.
Massive fail. Excuse me for being out of order.
Yeah, you're out of order, Commissioner. Or, I mean, excuse me, whoever you are out there. You're out of order. You have your time to talk. What's up next, Gary?
Okay, next is the consent agenda. Shannon, would you please read the consent agenda by title only?
Health, Housing, and Human Services, approval of intra-agency agreement with Clackamas Health Centers Division for school-based health centers. Operating funds maximum agreement value is $180,000. No county general funds are involved. Approval of interagency agreement with Clackamas County Health Centers Division for school-based health centers. Building mental health services capacity. Maximum agreement value is $185,000. No county general funds are involved. Approval of a home loan amendment number 1 with Green Line Affordable Development Limited Partnership for the Fuller Station Affordable Housing in Happy Valley, Oregon. Total contract amount, $950,000. No county general funds are involved. Approval of H3S Community Development Division Housing and Urban Development Grant Agreements for signature, $3,485,000, 810, sorry, let me start again with that amount, $3,485,810,000, total funded by Housing and Urban Development Funds. No county general funds are involved. Approval of an intergovernmental agreement with Oregon Health Authority, COVID-19 vaccination operations. Maximum contract value is $1,200,000, funded through the Oregon Health Authority. No county general funds are involved. Transportation and Development, approval to apply and letter of support for a federal land access program grant to provide a pavement overlay on Barlow Trail Road. Grant value is $4,994,254 with matching funds of $565,892 from the road fund. No county general funds are involved. Approval of 2019 to 2021 House Bill 2001 and House Bill 2003 Planning Assistance Grant Agreement with Department of Land Conservation and Development, DLCD grant number HA 23-160. No matching funds are required. Elected officials, approval of previous business meeting minutes. Public and Government Affairs, approval of a board order renewing the cable television franchise agreement for use of the county rights of way by Beaver Creek Cooperative Telephone Company through September 23rd, 2031. This agreement provides franchise fee revenue totaling 5% of the gross revenues for the cable operator. No county general funds are involved. Resolution Services, approval of an intergovernmental agreement with the Oregon Department of Human Services for adoption and guardianship mediation services. Total agreement value is $300,000 through July 31st, 2024, funded through Oregon Department of Human Services. Disaster Management, certification of designation of agent resolution for FEMA Hazard Mitigation Grant Program 5327. Total cost is $85,000 with a 25% local match at $21,250. Monthly service fees are $630. 25% funded through county general funds, already in the disaster management budget. Approval to apply for FEMA 2021 Building Resilient Infrastructure for Communities, BRIC, grant funds to sponsor Portland General Electric Highway 26 Electrical Utility Project Stage 1. Estimated total project cost is between $400 and $600 million. Grant will seek $50 million a year for 3 years to cover 75% of federal grant share. PGE will cover 25% local match fund. No county general funds are involved. Approval of memorandum of agreement between Clackamas County and the Molalla United Methodist Church for emergency disaster-related use of the church. This MOA has no monetary value. Finance, approval of purchase of annual software support service from Oracle America, Inc. for PeopleSoft software. Annual cost is $506,304.10, funded through Technology Services, which receives county general funds. Business and Community Services, Approval of local grant agreement amendment number 5 between Clackamas County and Micro Enterprise Services of Oregon, MISO, for MISO to provide a small grants program on behalf of Clackamas County in support of the local business community impacted by the COVID-19 pandemic. $2,467,500 through CARES Act and $51,600 through state lottery dollars. No county general funds are involved.
That ends the consent agenda.
Does any commissioner wish to pull anything from the consent agenda? Seeing none, I'll entertain a motion.
I move to approve the consent agenda.
Second.
Motion has been made by Commissioner Scholl and seconded by Commissioner Schrader. Any further discussion? Shannon, please call the poll.
Commissioner Scholl?
Aye.
Commissioner Savas?
Aye.
Commissioner Fisher?
Aye.
Commissioner Schrader?
Aye.
Chair Smith?
Aye, motion passes 5-0. I will now recess as the Board of County Commissioners and convene as a Water Environment Services Board. Shannon.
Water Environment Services, approval of a joint funding agreement between Water Environment Services and the U.S. Geological Survey for Johnson Creek water quality and flow monitoring, valued at $10,000 from WES Surface Water Operating Fund. No county general funds are involved. Approval of a joint funding agreement between Water Environment Services and the U.S. Geological Survey for Tualatin River water quality and flow monitoring, valued at $5,800 from WES Surface Water Operating Fund. No county general funds are involved.
Does anyone wish to remove anything from the West consent agenda? Seeing none, I'll entertain a motion.
I move to approve the Water Environment Services consent agenda.
Second.
Any further discussion? Seeing none, Shannon, please call the poll.
Commissioner Schrader?
Aye.
Commissioner Savas?
Aye.
Commissioner Fisher?
Aye.
Commissioner Scholl?
Aye.
Chair Smith?
Aye, motion passes 5-0. I will now adjourn as a Water Environment Service Board and reconvene as a Board of County Commissioners. Up next is public communication. This portion of the agenda shall be limited to items of county business which are properly the object of board consideration and should be nonpartisan in nature. As the BCC is a nonpartisan governing body under ORS and county code, testimony is limited to 3 minutes. As a reminder, you can email submissions for public communication at bcc@clackamas.us, and these will be accepted as part of the public record. However, we will not be reading them at the business meeting due to time constraints. There's been a lot going on this week, and we've been receiving emails representing all points of view on a variety of issues. Today, we're going to give everyone a safe space to speak their mind. I will not tolerate disruptive behavior. I will not tolerate insults. I will not tolerate screaming and yelling. Yesterday, we had people call into our office and berate our staff for a comment from one of our commissioners. If there's anything online, if there's any testimony even remotely similar to that, it will be paused. I will adjourn the meeting, and no one will speak. That person will be removed permanently. Permanently. I will not tolerate anything. I will not tolerate that type of behavior. I will not tolerate violence. What I heard in my office yesterday, I was, again, very struck by that. So you have the right to disagree. You have the right to state your opinion, and I'm going to submit to everybody listening. This is one of the few venues across the region, if not in the state of Oregon, that allows weekly for people to come forward and exercise your First Amendment rights. So I suggest you do what you can to keep that right. Up first, Paul Edgar, come forward, state your name, residence, and you have 3 minutes.
Good morning, County Commissioners. I want to thank every one of you personally for what you're doing and giving to all of us. I appreciate it, number one. Just thank you. I wanted to come to talk about transportation. It's a big issue and this tolling that is being proposed, this experiment that is being proposed on I-205 and the Abernathy Bridge has a potential of costing thousands of jobs, hurting our economy in a manner that is terrible in all of the side effects. It is called diversion, or ODOT calls it rerouting. And rerouting, people will drive and do crazy things just not to pay a toll. It's like a fee or an assault onto their integrity, their choice. And what tolling the Abernathy Bridge will cause these people to flood across the old Oregon City West Lynn Bridge into the maze of downtown Oregon City, and all of the highways like 43 and 99E, and all of the side streets will be compromised in the safety on those streets where all these people are going to be trying to figure out a way to get around this maze. Willamette Falls Drive will be stopped. And so all I'm asking for, and I've sent an email out to you guys in the past, is for an open sessions where we have it's almost like a work session, but it's whatever it is to get it out where people get a chance, because this is such an affront. And this is one of the reasons why many of us believe we need to have a vote of the people on something as serious as this, because it disproportionately hurts Clackamas County in a manner that is unequaled with all of the rest of the counties. This, I look at this big Amazon project that they want to put in Canby. What do you think the hell is going to happen, excuse me, with all of these vehicles and trucks? I can see them flooding everywhere. But we put a roadblock up. 99E at Oregon City, so if you get the people coming across from West Lynn, they come up to Main Street, about 70% of them
Thank you very much.
Go to Highway 99E.
I just want to say, I read your emails, and then they're very good, and I understand your position. In response to that, this board is going to have a town hall on tolling soon. I forget which month it is. But we think it's a further discussion that needs to have, not just a policy session, because we want people to be involved in the discussion, so therefore we're going to have a town hall, be virtual, which I think is really easier for people to attend in the evening than getting in your cars and driving across county. Commissioner Savas, you're up.
Yeah, that town hall is December 1st.
Thank you.
On this topic, and I'll happily expand at that town hall on some of the points that you made, not all of them, but some of them. It is an experiment. It's an experiment in the sense that we'll be the first place in the nation to toll all the lanes on the interstate in an urban metro setting.
Yep, thank you for that. Thank you, Paul. Next up is Joe Haverkamp. Come forward, state your name, residence, and you have 3 minutes.
Joe Haverkamp, Oregon City, Chair and Commission. You don't mind if I someday bring the drama class to the meeting, do you?
There you go.
Because this was a drama, and I know it's supposed to be a nonpartisan, but this is not nonpartisan. This is a political thing that's going on here. Now, I know that Commissioner Fisher said that she wanted to meet with you, and she wanted to meet with all the commission. And if she was to meet with all the commission, could we either go to coffee, the Street of Dreams, or go out to a bar? Well, and she said that if it's not productive if all the commissioners don't get on, that they don't work together. And then 3 days before that, she wrote a nasty letter in the newspaper and said that all this about Scholl. Well, from what I understand at your meeting, you were going to reprimand Mark Scholl again for something he put in. And I won't take the time to read it because I won't be able to complete reading it. But it's so true. My family is from Germany. I know all about this. I have a lot of Jewish friends. And I faxed them and said, is this something that should be reprimanded on? And they said, no, if it was up to us, this is Jewish people. They said, you have to pay attention. This is what's happening in the United States right now, with all of our rights being taken away from us. And I don't think that you should ever reprimand somebody. This is called freedom of speech in America. And if you can't have any freedom of speech, what is this country coming to? I think that you need to have a psychologist, well, no, I would say psychiatrist, that's better. Come to your meetings and see who the culprit is that's stirring all this commotion up, because I already know who it is, and it's this lady right here. She would be excellent in our drama class because she commits drama. She has to be the center of attention in most of the meetings that you have. I think that you need to know this is something that's not put in concrete. When Tootie wanted to do this proclamation, she's already asked you people in other meetings about this. Come to her, come to her. How many people came to her? No one came to her until they had a public forum that they could have the public listen to. Well, the public's not really in favor. They're having a bad situation with this commission.
Thank you very much.
And they are very unhappy.
Up next, Christine Kennedy. Come state your name, residence, and you have 3 minutes.
Good morning. Can't hear me. Good morning, Chair Smith, Commissioners. I just want to say thank you to Philip Mason Joyner for the report today. I really appreciate having regular reports, and it's good to hear that the numbers are better. My sincere condolences to those who lost loved ones to COVID this week. It's really been an awful time for so many of us. We're in the 18th month of this pandemic, and we've now surpassed the total number of deaths from SARS-CoV-2 as were experienced during the 1918 flu. I have to say kudos. Oregon and Clackamas County actually are doing relatively well with vaccination. And we continue to see that Oregon has a relatively low death rate, unless you were the one that was impacted, but a relatively low death rate of 86 per 100,000 people. And still there's only 4 states in the country that are lower than us in terms of death rate. Lower. So we're doing well. We have a low death rate. I've heard a couple times, and again, I'm a nurse, retired nurse, 45 years at the last medical hospital that I worked at. It was a university setting. I sat on the Board of Ethics. And that is a huge education and a huge need for us to look at issues from all kinds of perspectives. I am very concerned about all the misinformation out there right now, but also it's free speech, right? So we've heard people talk about the Nuremberg Code. That was actually an old It was developed after World War II because there were ethical issues in medicine. There's power issues in medicine. So we have to make decisions. Things are not always clear, black and white. We know that. I've heard folks talk about do no harm. That is often cited as the first ethical principle. There's also 3 others. Do good. That is what we're about, right? Beneficence. We're all about that. We want to do good. That's why we're doing the work we're doing. Autonomy. That's very important. The issue of choice, individual choice. The 4th is justice. We have unlimited expectations of our healthcare system. Unlimited. I have spent hours, hundreds, thousands of hours dealing with issues around the workforce. Around how do you deal with the individual employee? How do you see what's really most important? Issues the patients are dealing with.
Thank you very much for coming forward. I appreciate your comments.
Thank you very much.
Up next is Yvonne Lazarus. Come forward, state your name, your area of residence, and you have 3 minutes.
Good morning, Commissioners. I am removing my mask. The only rule I am violating is of the building policy, which exceeds the state and federal regulations. I will replace it after I get done speaking. More drama. What I saw go on here today, again, took me right off of what I had here. This was disgusting. You're tearing this, and of course, I have leprosy. The drama and the not standing pat and fair with each other is so wrong. And I apologize to you, Tootie, for what went on here today, and to you too, Mark, because since Mark and Tootie have come to this commission, this is the kind of garbage that's gone on. How can they do any good work when it's like this? It's wrong, and you guys know it. I mean, Paul, your body is telling you it's toxic. It's toxic up here. I've been wanting to say this to you for a long time. What's in your heart? Obviously, you're doing something that isn't right with you. You've been here a long time. A long time. You should have put this right on through. Mark, it's like Joe said, Mark, the things that he has spoke of that a lot of people have gotten upset about, all it is saying is, it doesn't take long, and you wake up one morning and they've chipped away, chipped away, chipped away, and you no longer have your rights. Period. And that goes for all of you who think that this socialistic way, this communistic way is right. It isn't right. We are 19th in the Freedom Index. Do you know we used to be #1? What in the heck is going on? I'm too old, and I shouldn't have to be spanking you. Period. No, that isn't funny. It isn't.
Thank you very much for coming forward. Up next Rick Kofel, come state your name, your area of residence, and you have 3 minutes.
Good morning, Chair Smith, Commissioner Schrader, Savas, Scholl, and Fisher. I am Rick Kofel, and I'm from Beaver Creek, Oregon. And I am tired of the beating up on Commissioner Scholl. It's got to stop. Yes, he does have an issue with acceptable word choice, but he does that for a response. And that isn't, his choice is freedom of speech. But that is his choice, but the bashing has to stop so you guys can work together to support the residents of Clackamas County, because that's what you're here for. I would like to thank Commissioner Scholl. We called him about an issue on the roads, with Beaver Creek Road being closed, Highway 213 having delays, and New Era Road being closed. And a day later, Beaver Creek Road was open. I appreciate that. Thank you very much, because that was a big issue for egress out of the Beaver Creek area. The weather's starting to change. I've got a number of things I'm hitting on. And we still have a lot of debris down from the wind and ice storms. As the days are getting shorter and nights coming on sooner, we're going to have a bigger problem with road delays and all that. We've got to get that stuff done here in a timely manner. That wood waste has got to get processed and get out of here so that we don't have another issue this winter. That's a follow-up from last winter. I would like to say the board has failed to support the Clackamas County workforce by tabling that measure of showing your support to the workforce. That is shameful. It is absolutely a mistake. We have to stand behind the workforce. And yes, there are some that will not get vaccinated and they will lose their jobs, but that has got to be their choice. There should be no mandate directing them to have to get a vaccine in order to be employed. That is just wrong. I'm also concerned about ODOT's plan to toll Highway 213 between Stafford Road and Highway 213. I know we had talked about having a town hall. That's great, but that is a concern, and it's going to be a bigger concern as we get closer to it. I am against that. The Veterans Advisory Council needs to focus more on advising the commissioners on veterans issues as opposed to beating up on Chair Smith and Commissioner Scholl. That is still ongoing, and that's got to stop as well. And the last point I'd like to make is I almost died from getting my first Moderna shot. It almost ruptured my intestinal wall of my large intestine. I spent 6 weeks with severe diarrhea and pain before I got treated, and I'm now still recovering from that first shot, and I need to get an exemption if there's one possible. But it was quite severe, and I had 3 months of almost on the verge of dying. Thank you.
Thank you. Up next, and I apologize for not being able to pronounce your name, Lynn Wonsky. And please come forward, state your name correctly, please, and list your area of residence, and you have 3 minutes.
Thank you, Chair Smith. My name is Lynn Winchie from Sandy, and I'd like to address, I want to thank you, first of all, your work here and for Commissioner Scholl's work here. I want to say that I personally know several people who've either had COVID or they currently have COVID. They're very sick and they are fully vaccinated. So the whole vaccine thing for them is worthless. This is not something I read on the web. These are people I actually know. I also know people in the medical field who are currently searching for jobs outside of Oregon. They intend to leave. Okay, so we will be losing them. And I came to say that I cannot believe that certain commissioners are still attacking Mark over an ancient issue that was resolved long ago when they should be working together on issues that are currently before us right here and now. As long as the commissioners are spending their time fighting amongst themselves, they are not working on behalf of the people of Clackamas County. Our freedoms are still being stolen from us piece by piece, and I'm asking the commissioners to stop this squabbling and do the work they were hired to do. Mark is not the enemy. Thank you.
Up next, Lila Blakely, come forward and state your name, residence, and you have 3 minutes.
Leila Blakely, Bull Run, Sandy, Oregon. Thank you, Commissioners, for having us today. I'm here today in response to the policy session that you held earlier this week. Commissioner Paul Savas' comment stating vaccine mandates are temporary. In case Mr. Savas doesn't realize, vaccines, and especially the gene therapy shots, are never temporary and stay in our bodies for life. This so-called mandate is intrusive to our civil liberties for our whole lives. They are not temporary. A very minute percentage of people who are determined to undermine anything Mark Scholl does or says should not represent what most of his and your constituents believe to be true and honest. People wonder, how is it that we didn't do something? We didn't run away, we didn't hide. Well, things didn't happen at once. Things happened very slowly. So each time a new law came out or a new restriction was said, well, just another thing, it will blow over. I've talked to my sister-in-law numerous times regarding what we are living in right now. She believes, as I do, this statement holds true to what is happening to us. I can say this because both of her parents escaped concentration camps. Not that they were only Holocaust survivors, but they both were in concentration camps and both lost most of their family. What is described above in part of what Commissioner Scholl posted is as true today as it was then. You are all aware that the Biden administration, along with our tyrannical governor, is mandating more and more, and some of you actually believe it is for the good of your health. Well, it's not. Most of your constituents can easily identify the value in the parallel. It's troubling that you fail to value and perceive the relevance in this current climate and instead resort to political correct manipulations, as is so vogue in our liberal so-called leadership. That's all.
Thank you. Up next, Les Poole, come forward, state your residence, name, and you have 3 minutes.
Les Poole, I live in Gladstone. I'm here very frequently. I don't even know where to begin, even though I'm here very frequently. I would say this. I'm extremely disappointed in the failure to pass a resolution that not only would be in support of the folks we're directing it at, but makes a statement, because anyone in this room that can tell me or provide any evidence that the governor, because this isn't coming from this legislature, it's coming from the governor and the erratic, politically motivated OHA, the Oregon Health Authority. No one blinked an eye when the Oregon Health Plan became the Oregon Health Authority, except for me. And now what we have is a room where I could probably from memory point out that Ms. Haverkamp, Commissioner Fisher's daughter, the gentleman Rick here that just spoke, let me think of who else. None of them can take the vaccine. None of them. And here we have the one-size-all-fits-all mandate. And it's not right. And the arguments that we heard earlier, the specious delaying tactics that we heard earlier from the commissioner that's not in the room, that keeps dramatically walking out, Those arguments were specious. The first people that had access to the vaccine and those that have clearly had ample opportunity to be vaccinated are those health workers and are the government workers. And the idea that because our political animal governor gives them a 6-week reprieve, something is going to be different, that argument is nonsense. We need to move forward in this county. And we cannot move forward because of the reasons given earlier by the other speakers. And I'll close with a general question, and I hope we can get some comments next week. What I see is we have a few trolls. We all know what a troll is. I won't name any names, who devote a fair amount of time, from what I can see, to going and digging and looking and finding things to be outraged about, things to exaggerate, things that can be used to politically attack folks. And I'm really tired of it. And this bizarre interpretation of everything, this little box interpretation of everything that Mr. Schull or others say or do, has got to stop. Thank you very much.
Okay, that is all the cards I have for in-person testimony. We will move now to the callers. Shannon, do you want to moderate that portion?
Yes, thank you, Chair. I have 9 people registered to speak today. First up is Angela Nyland. Angela, please unmute yourself. State your name and residence. You have 3 minutes.
Good morning. Can you hear me?
Yes, we can.
Okay. Good morning, commissioners. I'm going to have to send an email after today's episode because I'm not going to be able to say everything I was going to say in 3 minutes. Listening to the last policy session on Tuesday and about the resolution and today, it was disappointing and frankly made me nauseous. I am shocked to hear that anyone on the board would think our medical professionals that have not gotten the vaccine are listening to misinformation from somewhere out of the county or out of the country. They are heroes. They got us through this pandemic. And on Tuesday's call, I repeatedly heard comments about this is taking a lot of our time. Well, we elected this board to spend the time required for any situation impacting Clackamas County. The comment was made, we need to do this or drop it. It should not be dropped, Ms. Schrader. Please note that 87% of vaccinated healthcare that was reported earlier, that's where the workers live. That's their residence. That is not where they work. We have plenty coming from Vancouver, Multnomah County, Washington County. People don't always work in the county they live. Since the board is nonpartisan, please consider removing the word political and the word fear, because that's assumed fear. No one can tell whether I'm afraid of anything unless I tell you. From the discussions, some people cannot take the shot. Some people are waiting for medical trials to end in 2022 and 2023. Some have religious reasons. You have constituents who will lose their jobs and not be able to get unemployment when this happens, even with an extension. That's just delaying the inevitable. It's not going to go away. How are you going to help feed the people of Clackamas County that aren't going to get unemployment like what was handed out so freely before with the pandemic? What about these people that are not eligible for unemployment that have lost their jobs? How's the county going to help them? How are they going to pay their mortgages? I also want to know, where are we at with a state of emergency declared for Clackamas County? Representative Drayden has already recognized that we could lose 30% of our fire personnel. The governor is ignoring her concerns. Clackamas County sheriffs may need to release prisoners depending on the loss of officers out at the jail, which could include removing patrol from covering out on the streets so they can cover the jail. Where I am in Boring.
Thank you very much, Angela. Appreciate it. Who's up next?
Next up is Michelle Bombit Minch. Michelle, please unmute yourself, state your name and residence. You have 3 minutes.
Hi, hopefully you can hear me. Thank you, Board of Commissioners. My name is Michelle Bombett-Minch. I am a resident of West Linn, and I am the chair of the Jewish Community Relations Council, the public affairs arm of Jewish Federation of Greater Portland. We represent the organized Jewish community of Northwest Oregon and Southwest Washington. This includes dozens of congregations and other Jewish organizations. Through our work, we promote democratic pluralism, harmonious relationships, and respect for human dignity and individual rights across religious, racial, and ethnic lines. Our work includes ongoing dialogues with our friends in the African American, Native American, Latino communities, Islamists, Catholics, Episcopalians, and many more. First, I'd like to clear the record. Commissioner Schul, there seems to be some confusion about who reported your offensive post to Bob Hornstein, the Community Relations Director at Federation. To clear the record, that, sir, was me. By now, you and much of the community have heard Mr. Hornstein's statement, but it bears repeating. Your post, Commissioner Schul, has brought pain and outrage. There just simply is no parallel between COVID restrictions intended for the safety and well-being of the public and the dehumanizing measures the Nazis implemented that led to the murder of 6 million Jews and countless other victims during the Holocaust. I read your response to Mr. Hornstein's letter with dismay and deep sadness because you didn't find it in your heart to simply apologize. And quite frankly, it's frightening that you just don't get it. The gut-wrenching pain that we feel when our experiences of tremendous, unspeakable loss are trivialized by use of Holocaust symbols and imagery to make outlandish, irrational statements about public policy. To quote Mr. Hornstein, to claim that mask and vaccine mandates during a pandemic are the same as the policies that evicted European Jews from their homes, stripped them of their livelihoods, forced them into crowded, unsanitary ghettos, and ultimately sent them to the death camps is appalling, offensive, and an affront to the memory of all who perished during the Holocaust. Anti-COVID measures trivializing the Holocaust fuel anti-Semitic conspiracy theories and tropes and underscores the need for education on anti-Semitism. A 2020 survey of American adults revealed that nearly half did not know what anti-Semitism is, and 1 out of 5 said they had never even heard of the word.
Thank you very much, Michelle. Your 3 minutes are up. Up next.
Next up is Catherine Peterson. Catherine, please unmute yourself, state your name and residence. You have 3 minutes. Catherine Peterson. We'll come back.
Come back, yeah, maybe she's having trouble.
Next up is Chris Waller. Chris, please unmute yourself, state your name and residence. You have 3 minutes.
Chris Waller, Jennings Lodge. As you may know, one of Commissioner Shull's hobbies is producing music videos. Lately, it seems he's been working on Britney Spears' Oops, I Did It Again. It's a nice pop anthem, but it shouldn't be the theme song for a county commissioner. Yet he did it again and again and again. In January, when his post stating Islam hates you, Islam is a noose around the neck of our community, Islam has invaded our nation, were revealed. In June, when he compared being asked to wear a mask to Jim Crow laws, and now when he posted a meme comparing measures to contain COVID to the Holocaust. His response every time? Cue the next music video, Taylor Swift singing It's Not My Fault. In this Tuesday's meeting, Commissioner Shull spent 0 seconds atoning for the harm and pain he caused to the Jewish community with his post, and over 2 minutes blaming me for his misfortunes, although he never named me, just referred to me as that woman. Apparently, I have become his version of Voldemort, she who must not be named. Commissioner Schull, I didn't make these posts or say the hateful things. You did. Yet again and again, you've blamed me and refused to take responsibility for your own insensitive and harmful actions. Or you've said it's cancel culture, or we just don't understand what you meant because, of course, you are right. Never ever can you admit that what you have done is hurtful or hateful. The latest example, you told Bob Hornstein, director of the Jewish Federation of Greater Portland, the post was intended to remind people that the restrictions on civil liberties are a slippery slope. What the post did is suggest that what happened in the past could happen again. Really, Commissioner Schull? Do you really believe what you wrote? Will you look into the eyes of someone who lost their grandparents or parents in a concentration camp and tell them that you believe being asked to wear a mask is going to lead to death camps, mass murder, and the near destruction of a culture? No, Commissioner Schull. The real first step toward mass murder and ethnic cleansing is the dehumanization of human beings, like what you have done by calling them invaders, parasites, monsters, enemies, Grendels, devils, Akbars, savages, dunderheads, festering threats, communists, rioters, Marxists, illegals, the wrong people. You have had the people whom you have hurt stand here and tell you what you have done, as Michelle just did. Yet you refuse to believe them and persist in your fantasy that everyone around you is prosecuting and persecuting you, and you are the white knight, the true patriot. There are none so blind as those who will not see. Thank you.
Up next.
Up next is Michael Weber. Michael, please unmute yourself. State your name and residence. You have 3 minutes.
Thank you, Commissioners. Michael Weber, Jennings Lodge. With Idaho and Alaska now rationing health care due to unvaccinated citizens flooding the hospital, we must come to the realization that deciding not to vaccinate, although still a personal choice, has real life or death consequences to fellow citizens, even the vaccinated. The 2 dialysis patients who died because 4 patients needed access to equipment that the hospital only had staff to operate 2 machines didn't die because of their vaccination status. They died because the hospitals were overwhelmed. We heard today that 87% of Clackamas County healthcare workers are already vaccinated. They are not leaving their profession because of being asked to be vaccinated. They are leaving because they are overwhelmed. We do not face a supply crisis, but a demand crisis, a demand created by people exercising their choice not to vaccinate, a choice often misinformed by propaganda and political prejudice. We should be doing everything we can to encourage people to get vaccinated, not thinking of ways out and creating excuses to avoid doing the right thing, the civil thing, the patriotic thing of getting the shot and protecting our neighbors. We should not be making a call to arms on social media to supporters to show up, to advocating for their vanishing minority position to be shielded from the consequences of their choice not to get vaccinated at the expense of the ever-growing majority. Briefly, on the subject of the so-called effective proven technologies, why on earth would we impose an additional tax on our struggling businesses by asking them to make capital expenses to retrofit their operations to account for people's personal choice not to avail themselves on what is available for free and that the county has gone through great lengths to make available? Unlike a school, businesses cannot get a bond passed to have the public fund upgrades to their HVAC systems. Is the commission going to set up a grant for each of these businesses to purchase these hundreds of thousands of dollar systems? A message to our citizens should be clear and consistent. Get vaccinated, wear a mask, practice social distancing. Anything else is working against the greater good. Thank you.
Up next.
Up next is Brainerd Brower. Brainerd, please mute yourself, state your name and residence. You have 3 minutes.
Yeah, I was going to say good morning. I guess it's good afternoon at this point. It's actually been a while since I've testified. It goes back far enough that testifying was kind of at the beginning of the meeting, which I've always thanked the commission as really our elected representatives. And really that's what our citizens in county have. It's is you as our elected representatives. I always thank you for the opportunity to speak. I'll do so again. I sure wish it was at the beginning of the meeting and when there's such a big topic that was later. Surprisingly, my reason today is not the topic at hand. It's also a safety issue. It also affects potential lives. The commission has helped in the past in the community of Redland, our rural community close by to you, in traffic safety. And today my request to the commission is to provide some assistance when it comes to Oregon City School District. And the Oregon City School District runs Redland Elementary School, the elementary school that I graduated from, that has changed over the years. And traffic management at that Redland Elementary School has changed a lot. Obviously, the number of people with vehicles coming to the school has changed, but the management, how traffic flow is done, has also changed dramatically. And we've had multiple discussions about it. Even Commissioner Savas has been involved with the CPO, and our local CPO chair, Martin Myers, I think was kind of skeptical, and then he witnessed it firsthand, and he was calling me on his cell phone going, oh my gosh. So it is something that until you see it, the Oregon City School District also, it could be 3 years ago, certainly a couple years ago, their own consultant witnessed close calls in just one session looking at the situation of the in-out during those drop-off and pickup times. And he concluded close calls, multiple close calls. And now we have a much more extreme situation where the bike lanes are being used as a third lane, backing up cars. The cars are causing sight distance issues at Fisher's Mill and Redland. And in the last discussion with the school district, and Kyle, I'm forgetting his last name, who's the assistant superintendent, had pointed out the need for safety at the school, at the Redland Elementary School. But the sense we all got was that the community traffic issue is of no concern at all for Oregon City School District. And I'm asking you as the commissioners, our representatives, to take a role in saying, no, the safety of our rural roads needs to be important. Manage the traffic. Go ahead and set up a place for parents to drop off their kids and take the last little bit bus to the school.
Thank you very much. Thank you very much. Nancy, will you instruct the road department to take a look at what he's talking about? Maybe they already have.
Yeah, they have.
I'm not familiar with the issue. We'll just continue on with our next speaker. Who's up next?
Next up is Minerva Bluford. Minerva, please unmute yourself, state your name and residence. You have 3 minutes.
Hello?
Yes, we can hear you.
You can hear me now?
Yes?
Okay. I'm concerned regarding what I saw in my 2 naked eyes, that people is in rushing going to and the other side. And the concern is the big truck who wants to overtake and go on the pavement almost pull out just to go in. And the next is the camper. And I saw that camper almost swing by on the ditch. My question is, are they in a hurry to reach their home safely, or are they in a hurry to pull on the ditch? And my concern is how to resolve this problem. Thank you.
Okay, who's up next?
Next up is Bill Weir. Bill, please unmute yourself, state your name and residence. You have 3 minutes.
Well, good afternoon, Chair Smith and Commissioners. Bill Weir, Damascus. I want to talk about 2 things. The first thing is what happened regarding Commissioner Scholl at Tuesday's policy meeting. This reeks of what happened on January 14th and June 1st. It's a political power play using Commissioner Scholl as a punching bag to cover up your own inadequacies. It's reckless of this commission to continually nitpick anything he says or what he did or didn't say and blow it up beyond sensibility. By doing this, you're not elevating the dignity of the commission. Now, the other thing is what's happened this morning. And the first thing I want to say is I want to compliment the chair and Commissioner Scholl for this resolution. And I know that it took a lot of work, and I would imagine you thought you had a lot of the opposition to it resolved by the last policy session. So it was quite a surprise that this went down, that it was tabled. I wouldn't have been surprised if it had gone down ultimately, but at least there would have been a vote on this issue. I believe that the structure you have of 5 commissioners is designed so that you do have a tiebreaker. To ask for a unanimous vote is basically tanking it. And if that's a goal, it's an unachievable goal, because at least 2 of the commissioners that you have are not going to go against the governor no matter what. And one example I want to give from personal experiences is out in Damascus, we had a comprehensive plan that was worked on for many years, many hours, many people. And it came to a council vote, and we had 7 on council. It was 3-3, and the tiebreaker voted no to send the plan to the people, and eventually we know what happened. No comp plan, we eventually dissolved as a city. So to insist on a unanimous vote is really doomed to failure. I think, Commissioner Savas, you've really failed the people on this one. Thank you.
Up next.
Up next is Tim Smith. Tim, please unmute yourself, state your name and residence. You have 3 minutes.
Yes, thank you. This is Tim Smith from Wilsonville. Boy, I repeat everything Mr. Weir just said, and the other 3, Ms. Lazarus and Ms. Haverkamp. Les Poole, I did with this. I'm changing my whole comments now from the defense for Mr. Scholl. I think he was just ran over on this coin thing. And Chair Smith, in all due respect, I was very disappointed that you cited in and cited people that were against Mr. Scholl, knowing that you've had these people in front of you all these months that say just the opposite, and you never even represented us in that coin interview. So that's disappointing. Anyway, with that said, I want to talk about what just happened today, and I'm appalled. Ms. Chair Smith, I empathize with you. You just got a little bit of a taste what the man next to you, to the right of you, Mr. Scholl, has gone through since day one. You've been sabotaged, Chair Smith. You've done a good job of standing up, but it's hard because you got 2 people against you, Ms. Schrader and Ms. Fisher. They're in it together. What really haunts me is this meeting you all had, I think 5 weeks ago, and the last 4 minutes, it was a power play against you, Ms. Chair, from Ms. Fisher. She's telling you basically, hey, why don't we go out for some drinks? And you said, I would never go out without a witness. And I would suggest, Ms. Chair, you take 2 witnesses with you. And Ms. Schrader, you want to tell us how to behave in this room. The only reason we're here in this room not getting paid is because you're not doing your job. Number 2, Ms. Schrader, I don't want to be condescended and talk to you like we're 3rd graders and like you know it all, and you're going to tell us all about the vaccines. We've heard enough of it. We want you to hear from us. Now, Mr. Savas, I agree with Mr. Weir. For the first time in my life, I saw you standing up for a cause like this, and then in the end, you tabled it, and that just totally destroyed us. Like good cop, bad cop. I have this YouTube thing of all you guys in that meeting I was talking about, where Ms. Fisher pretty much told Chair Smith that is a power play, that she had the vote, and Mr. Savas, you were in her back pocket, a 3-2. Well, it became a 3-2. You should not have tabled this. It's just like you cited with Ms. Fisher. Ms. Chair, you do have a problem here. It's these three, especially those two. And again, Mr. Shull, I guess I'll have to talk about this Jewish thing. Nothing even close.
Thank you very much. Thank you very much. Who's up next? Shannon.
We're going to try Catherine Peterson again. Catherine, please unmute yourself, state your name and residence. You have 3 minutes.
Hi, can you hear me?
Yes, we can.
Hi, this is Kathy Peterson from Oregon City. And what I want to talk about today is that we have 2 states now. Alaska has joined in with compassionate care because of the COVID and unvaccinated people taking up hospital ICU beds. I lost my mother and she was a teacher in Woodburn Elementary School, and this happened a long time ago. If this had happened today, and we lived in, say, Idaho, she would not have been able to get an ICU bed because of COVID patients. She had heart trouble. And that just seems unconscionable. And I just want to say, people today talked about their freedoms because they don't want to be vaccinated. What about freedoms of people that want to get care in hospitals and they're coming in with a car accident or a hospital or a heart condition like what my mother had? What about their freedoms to get care in a hospital? I believe in the mandates right now, or masking or those kind of things. And I wouldn't have been left an orphan or raised by a father he was left with 4 children. And I worry about all of these children being left because their parents are dying. And it just seems so sad that we're not thinking about the freedoms of people that are unable to get care in hospitals or their freedoms. And we're just thinking of selfish people that don't want to get vaccines or don't want to wear masks anymore. And that's what I have to say today. That's all I have to say. Thank you for listening to me.
Thank you. Shannon?
That is the end of my list, Chair.
The end of your list. Thank you. Now we go on to administrator comments. Nancy.
Yeah, thank you, Chair Smith. So in the interest of time, we're going to skip that today. So I'll turn it back over to you for Commissioner Communication.
Thank you. And we're going to adjourn the rest of this meeting. We've said enough today.